um, Infertility and in vitro fertilization. IVF involves combining an egg and a sperm in a laboratory. Once the embryo are formed, we place those embryos in the uterus for implantation. Then after about 10 days, we do the pregnancy test, which confirm whether the pregnancy have happened or not. What causes of infertility can IVF treat? It's a very important question. What are those causes wherein IVF can help us to get pregnancy in an infertile patient? This patient usually with endometriosis, patient with the low sperm count, patient with fallopian tube blockage, patient with dysfunction as far as ovulation is concerned, patient with poor egg quality, and the last is probably patient with what we call unexplained infertility. Therefore, this category of patient qualify for IVF and most do very well. Now, what are the success rate of IVF? Looking at the statistics published by CDC, which is a Center for Disease Control in America, report of 2018, women below 35 have 50% chance of getting a live birth in IVF. And women which are above 42 have 3.9% of having a live baby through IVF. Now, the most important thing which we're going to discuss as well is the steps, summaries, steps by step in IVF, in which I want us to know as people of Joburg Fertility and even people in Africa at large, because most of our patients come from Africa and probably in South Africa itself. Step one is a medical treatment to stimulate the ovaries. The ovaries are stimulated so that they can produce eggs. And those eggs, medically, we call them follicles. Now, those follicles are produced because of stimulation. That can be oral medication, and that can be using FSH or LH. All help to produce more follicle. In a natural environment, a woman will produce 1 or 2 eggs per cycle. But in an IVF, we tend to increase the production to 5, 10, 15, or even more, though we're not encouraging that it should be more than 24. Step 2 in an IVF, it's monitoring, the most important phase as well, that the treatment is taking its course and check for the side effect related to the treatment. Now, the follicles are measured. The size is measured, and we expect that with a good treatment, the follicle should be 18 to 22 millimeters on both left and right ovaries. Transvaginal ultrasound is used to look and measure those follicles. Then blood levels as well, estrogen and P2 are monitored as well. We don't need a high level of estrogen, especially higher than 3.5, that can cause problem, especially OHSS, which stand for ovarian hyperstimulation syndrome. That's a very lethal condition, which we always have to be careful when we're doing through IVF, that we don't get at that level. Although sometimes it may be difficult to prevent, but it's what we're trying to get it lower than 3% in most of our cycles. Step 3, it's egg collection. Now, when the follicles been measured by ultrasound and found to be of equal size, by that I mean 18 to 22 millimeters, then the patient can get what is called a trigger. A trigger is a last medication injection we give, which will allow now in the follicle or in those cysts follicle, that as we know that the egg is actually attached to the wall of the follicle, and with a trigger, then the egg can start floating in the middle or in the fluid of a follicle. Then we then book the patient to come in and do what is egg collection under sedation. And then in that process, we can then takes about 20 to 30 minutes to pick up all the eggs. And then the patient is given antibiotics and anti-vomiting medication and even uh, pain medication. Step 4, it's a sperm is collected from the husband, or it may be a donor sperm. And as the sperm is collected and the eggs is collected, then the eggs and the sperm are then combined. In other words, you can do an IVF where you put them both in a culture media so that fertilization will help naturally, or you can then inject the sperm in the egg that we call ICSI, so that fertilization can be enhanced to increase the fertilization rate. The fourth step, or the sixth step, sorry, it's embryo transfer. This will happen usually depending on the center. Some may do what we call day 2 transfer. Some center may do day 3. Some center may do day 5. All of these days which transfer can be done depend on the center and also depend on the quality now of the embryo. Now we're talking of the embryo because remember, fertilization have happened, and after fertilization the eggs have gone through all the changes to morula. Now day 2 3 is it gone now to blastocyst, which is day 5, with grading now come in, and so that we know what quality the eggs may be. The grading may go from 1 to AA to B, C, and D, depending on the quality. Obviously, A, B will be the best quality you have, which during transfer you lose those best so that you can achieve pregnancy. Now, after the transfer is been done, about 10 days, then we do what is called pregnancy test to confirm whether pregnancy have happened or not. Good luck in this journey. I think I've summarized in short with all silent, more important points as far as IVF is concerned, and which will help everybody to understand the process of IVF. Looking at ICSI, it's just part, as I said, of it's a small part. It's just a very expensive machine which we use during fertilization, which you call an ICSI machine. Therefore, the whole process of ICSI or IVF ICSI is really the same. It's just only introduction of that part which facilitate or increase the fertilization rate. Thank you.